Hello, everybody. Welcome to the Extra Executive Training Program Virtual Open House. Good morning to some, good afternoon to others. My name is Geneviève Martin. I'm the Senior Improvement Lead at Healthcare Excellence Canada, working on the Extra program, and I'm joining you from my home office in Ottawa. I must remind everybody that this session is being recorded. And also, as I said, I'm joining you from Ottawa, which is the unceded territory of the Algonquin Anishinaabe, and I'm very fortunate. I'm very thankful for the land where I get to play, especially in this pandemic. I have enjoyed, just really been thankful for the beautiful land around the Ottawa area. So without further ado, I will introduce, please introduce yourselves in the chat. And I just wanted to talk a bit about some housekeeping in terms of questions. We welcome questions at any time during the presentation, and there's a few ways that you can ask those questions. You can raise your hand in the Zoom. You can use the chat box, or if you want, you can turn on your camera and give us a little wave, and we will see you and call upon you to ask your questions. So please feel free to ask the question anytime during this presentation. I am not alone today to talk to you about the Extra program. I'm joined by Patti OConnor, who's our lead faculty, advising us on the curriculum, on the leadership curriculum. And Courtney Bean, who's the Vice President in Integrated Health and Partnership at VHA Home Healthcare in Toronto. Courtney was part of the 15th cohort of Extra, and will come and talk to you about his experience of doing the Extra program. So just a bit about the objectives of this open house, obviously, is to give you an overview. There's some information on the website that you've probably read, but just giving you a bit more information on the program, the faculty, the coaches, the program objectives, some of our activities and deliverables, and give you get an idea to see if you're ready to join this program, if you've got the components in place, and also to connect with Courtney, the fellow, to hear about their experience in the program. I wanted to start to talk a bit about Healthcare Excellence Canada and the Extra program. Reason I wanted to talk about Healthcare Excellence Canada is that if you haven't heard, Healthcare Excellence Canada is an amalgamation of the Canadian Patient Safety Institute and the Canadian Foundation for Healthcare Improvement. So CPSI and CFHI are now Healthcare Excellence Canada. So we've joined efforts, and we got a greater capacity to both improve quality and patient safety across Canada. So if you talk to people who have been through the Extra program and they refer it as the CFHI Extra program, I just want to reassure you that it is the same program under Healthcare Excellence Canada. And we are in the midst of our strategic planning, but during our branding exercise, we have heard from a lot of our stakeholders that they really wanted us to strengthen diversity, inclusivity, look to the future, and have a clear purpose and focus, and being bold and agile, move quickly, and really share our expertise in quality improvement and safety with others. And the reason I bring these up is that this will influence the content of the Extra program, right? And as we develop our strategy, we can keep you informed, but this will come through during the Extra program. So the Extra program is the longest running program. It started 16 years ago. And it has evolved, obviously, since then, but there have been 160 Canadian organizations that have participated for a total of about 500 alumni right now, and current fellows who are doing the program. And we have seen 254 improvement projects. So it's really exciting to see every year get new cohort and new programs. So it's a 16-month program. We know that different teams will go at a different pace. So just want to reassure right off the bat that there's no expectation that your project will be finished at 16 months. So just want to say that at that point, you'll have what you need to continue if not finished. But I just want to reassure people about that. We work a lot on co-designing from the thought of the project to the implementation to the evaluation. And we'll talk about this a bit more later, but aligned with your strategic priorities. But the extra program is a team program, but it's also an investment in the individual because we develop leadership, but we're also trying to build the organizational capacity to improve. So even though you're building individual leadership skills, we also want these skills to transfer to your organization and build that capacity to improve. Again, just touching on this lightly now, and it will be touched in a bit in more detail coming up. But we have what we call the core extra team, and then there's the implementation team of your project. But the core extra team are usually about 3 to 5 team members. Ideally, there's one of these members that's a part of senior leadership. It can be from one organization or from multiple organizations. You do not have to work at the same organization. Doesn't have to be a hospital. It could be, or it doesn't have to be a health authority. It could be a community organization. It could be a ministry. You can combine. You also can have a person with lived experience or patient partner to become part of your core team. This is fairly new, and we have one team currently in the current cohort where the patient partner is fully part of that core extra team. You can be providers, you can be administrators. There's no set rule for the team, but a nice mix of members that will have the background and the roles needed and skills for your project to be successful. So I will pass on to Patti OConnor, our lead faculty, and Patti can speak a bit more about the program. Let's see if Patti is with us. There she comes. There she is.
Sorry,
okay, Patti. Hello.
Forgotten to turn back on again.
Okay.
So good afternoon or good morning for those of you coming from the West. And there are many of you and from our territories as well. This is fabulous. I am joining you from the unceded territories of the Haudenosaunee, the Iroquois, and the Mohawk nations. And I live in the city of Montreal. I'm the former Chief Nursing Officer, Director of Nursing at the McGill University Health Center. And I work now as a consultant, and that the work is primarily with HEC, Healthcare Excellence Canada. And I'm the leadership lead and faculty for the extra program. And just as an aside, I am actually someone from the very first cohort of the extra program. It was launched in 2004, and at that time, it was a 2-year program. Okay, so next slide. The extra program is the flagship, and as Genevieve said, the longest running program at HEC. There's a strong network of partners responsible for program oversight. That's our advisory committee, the development of the curriculum, our curriculum development working group, and overall evaluation with evaluation experts from HEC. The staff who anchor this program are Genevieve Martin, Kim Kinder, and Thea Anthony. They're there to support you at each step along the way. The extra faculty members are renowned Canadian and international experts and organizational leaders who have extensive experience leading healthcare improvement initiatives. The extra program allows fellows to deepen their knowledge of the Canadian healthcare system, while guest faculty from other countries provide insights into other healthcare systems, governance models, and policy directions. Typically, the faculty advise on program design and curriculum development and deliver the program, along with the guest presenters. They identify opportunities for shared learning between organizations, such as the Canadian College of Health Leaders, with whom we collaborate a number of times throughout the extra program. They provide advice and guidance to the improvement teams, and the faculty, all of them, are available for consultations with teams at any time throughout the program, not just during the times when they're giving seminars, but if a few months later you feel like, geez, I really need to have a conversation with so-and-so because I'm still not clear about my measurement plan, we'll hook you up with Sarah Alver from HEC. And our coaches network includes experienced healthcare CEOs who meet monthly with the teams to provide support and guidance. There's one coach per team. Next slide, please. One tool we use across all programming at HEC is the 6 levers for accelerating improvement. It's based on research that was conducted by Dr. Jean-Louis Denis and Ross Baker, examining high-performing health systems across the world. The aim of their investigations was to identify the essential elements to successful health system change and transformation, including long-term sustainability. These are the 6 key levers needed for successful change. Focusing on population needs means understanding the population you serve. This will enable your organization to provide the right care at the right time and at the right place. Engaging your healthcare providers and frontline managers to collaborate and become agents for improvement helps to build a culture committed to providing better healthcare, better health, and better value for money. Building capacity and self-reliance for improvement within your organization means training staff in quality improvement, giving them the ability to identify necessary improvements based on evidence, and supporting them in implementing these changes and recognizing them for doing so. Creating supportive policies and incentives means implementing organizational policies that ensure a healthy workplace and support employees to acquire and use improvement skills. Engaging patients and families and identifying what matters most to them is a powerful driver of successful change. At HEC, we see partnering with patients and families as a key design element, reflecting the value, nothing about me without me. And finally, promoting evidence-informed decision-making means ensuring that healthcare providers and their managers have access to up-to-date information and are trained in finding, assessing, adapting, and applying data and evidence for improvement. Excuse me. Next slide, please. Our goal in the extra program is to create an exciting, positive, and safe learning environment, as well as a larger network of peers across Canada, one that you can continue to draw on for many years. With a strong focus on experiential learning, a key requirement of the program is to plan, execute, and evaluate a major change initiative while further strengthening your organizational leadership skills. Core content in the curriculum includes a focus on quality improvement methods, change management, and team effectiveness, quality, cultural humility and safety, sustainability and spread of innovations, and engagement-capable environments and co-designing care with patient partners. Beyond those main content streams, we also explore leadership development, value-based healthcare, health system transformation, joy at work, and design lab innovation. The arrows on the right side of the slide indicate some of the key deliverables from fellows. So, for example, the first step is examining the evidence regarding the problem that you're addressing. The development of a logic model using a driver diagram, which we'll teach you about, and developing your measurement plan. Regular project updates are expected from the fellows, and a final presentation and submission of a final report. Multiple organizational assessments will be completed throughout the program using tools such as our organizational assessment tool, which is based on the 6 levers, as well as other organizational assessment tools. Next slide. The learning modalities, excuse me. The learning modalities that we use are shown on this slide. They include a combination of webinars, in-person workshops, self-directed reading, team-based coaching. And case studies are another modality frequently used in the in-person workshops. And there are multiple online resources, including the Extra Desktop, an online learning platform that's designed for the Extra Fellows. The desktop includes all the materials needed for the sessions and workshops, a calendar of events, info on assignments, and newsletters. With a focus on principles of adult learning, all teaching sessions include a high degree of interaction with the fellows, and peer-to-peer learning and feedback sessions allow the fellows to simultaneously become grounded in the core content at the same time as strengthening your network with each other. Our coaches, as I mentioned, are senior health system leaders selected for extensive knowledge and experience leading health systems and improvement initiatives. These coaches work hand in hand with improvement teams, providing advice and guidance on the design, implementation, evaluation, and promotion of improvement projects, including tactical and strategic approaches. The coaches understand the organizational and policy context of regions across the country, as well as the complexities of lean care in dynamic organizations. They're well equipped to help teams anticipate and navigate challenges. And they provide insight on strategies to gain momentum and support for the improvement project. So all these elements combine to support executive leaders in the successful implementation of a major quality improvement initiative, while also providing learning that's immediately applicable to the healthcare executive work. And now I'd like to introduce you to Courtney Bean, who is a fellow from cohort 15. We're currently in cohort 16, and you all are inquiring now about our cohort 17. So Courtney was from 2 cohorts back, and he's going to talk about his experiences and why he decided to take part in this initiative and what it's meant to him. Thanks very much, Courtney.
Great, thank you, Patti, and hello, everyone. You'll read in the chat, I have acknowledged the many peoples whose land, I have the honor to be speaking to you from here in Toronto. And, it's a real honor for me to be here to speak to you. And it's very exciting to see so many people from all over the country. So my name's Courtney Bean. I'm the VP Integrated Care and Partnerships at VHA Home Health Care. And as Heidi mentioned, I was part of cohort 15. And, I remember, thinking back to this moment where you're trying to think about making the commitment. Is this something you can do? Why are you doing it? When are you going to fit this in? Some things come to mind when I think about this stage that you're currently in. When I think about why are you doing it, what comes to mind is that you're doing this for you. It is, and so I'll tell you right off the bat that this is an excellent program. It was an excellent experience being part of the Extra program. And, the learning that I obtained, as well as my whole project team obtained, was substantial. And so you think, I'm busy. It's a pandemic going on. When am I going to fit this in? And, those are the exact same things that were going through many of our minds as we made the decision to make the application. And the reality is that we're always busy. And the fact is that you are looking at trying to take an initiative that you're passionate about, that you think is really important for your organization to the next level. And that's what this program will allow you to do. So a little bit about our Extra program, our Extra project. So on my team, there are 5 individuals from 3 separate unique organizations. all from healthcare, 3 from an acute care hospital, 1 myself from a home care organization, and 1 from a community support organization. So 3 separate organizations, and we've done some work together, minimally, but this was a huge endeavor of a program that we decided to roll out to deal with flu surge, and to reduce hospital stay time, get them home, providing kind of hospital at home like service for COPD clients. So we rolled it out literally in a few weeks, to get it going, and realize that there's a really great promise with this initiative, and how do we bring it to the next level? And so hence we were introduced to the Extra program as something to consider. So here we are, 3 separate organizations, 5 individuals. We have not really worked so intimately together. And I actually look at our application to the program as our start of the Extra program. And why I say that is it really was our first test of teamwork. The 5 of us realized pretty early on, and it was definitely, solidified throughout the program, that we are 5 high-level thinkers, not always the greatest at getting down to, oh, is there a due date for that? And things along those lines. So we were lucky that in our application, we were able to use a project lead to help keep us on track. We provided them the information. They kept us on task for when dates needed to happen, when things needed to be submitted. But I considered that individual part of our implementation team, for us at being kind of at the steering team level. So they kept us on task in terms of getting our things done so that we got our submission in for the application. And we were lucky to have been chosen to be part of cohort 15. So if you have that within your team, great. If not, looking at how you use other resources around you, I think it can be very, very beneficial. So I call it kind of our first project plan was getting the application in and submitted. So during the program, I've already told you that, I felt the program was absolutely amazing for me, for my team, and for the program and project that we led. But there were some learnings that I kind of walked away with. One learning was never to underestimate the amount of work that needs to be done. So, I'm not going to say that this is an easy program. It isn't. It's a lot of work. And when I was looking at, or after we were accepted, one of our board members told me how he knew of some people who've done the Extra program, and that they've all said that it's a lot of work, but it's an amazing program. And, now having completed the program, I can say the exact same thing. So there is work to be done, but you have to remember you're doing this work based on a project or a program that you are trying to launch. And it really is allowing you to kind of take that program to the next level beyond what you probably would be doing without some of the guidance from the faculty and coaches. When you do attend a session, I really think it's important to allow yourself to enjoy the session. So there is a lot of work, as I said. There's lots of reading. There's assignments that you have to submit. But I tell you, the sessions are engaging. The guest speakers, the faculty are amazing. The time you get to spend with your coach to help guide you and direct you. There's a lot of potholes we find that we fall in because we always need to get programs up and running yesterday, and we don't do the due diligence to make sure it's rolling out in the way that it really should, or in a way that might be sustainable. And I find that a lot of the guidance and support is really helping you develop a program that is truly sustainable and that from which you can grow on. And that kind of leads me to think about the fact that you have to be ready for a lot of feedback. So you're going to get feedback. You have to go. You're hoping, and the feedback is amazing because it really is taking you to a point that you can elevate the work that you're doing, and it really helps to kind of redirect and focus the work that you're doing. Be ready to learn. Be ready to apply kind of the principles that you hear. It's a program where I found the learning extremely practical. It was extremely applicable. It was easy to apply to not only the program that you're presently doing, but to every program that's going to come afterwards or any other program that could be on your desk at the same time. So it really is applicable to what you're going to be doing as a healthcare leader. And and a really important piece that I walked away with from this program, and something that I think was a huge weakness, was also remembering how to celebrate successes. And an important piece as a leader is making sure that you and your team, recognize those celebratory moments, and when you've been successful, and to make sure you're engaging as much from a quadruple aim perspective, worrying about the patient experience, that making sure your team and the providers who were involved are also having a great experience with the launch of this project or program. So I like to use a quote, and it's a quote from Mr. Rogers, for anyone who's old enough to know Mr. Rogers. And the quote is, "I've always wanted to live in a neighborhood with you." And the reason I like this quote is it makes me think about the value of the cohort, the rest of the teams that you're working with. So when we started our program, the faculty and coaches encouraged us to try to get to know each other. And I have to say, very early on, we were, for many of us, like for my team, we're from different organizations, we were still trying to get to know each other, that we probably didn't jump on board as early as we should have. But once we started to engage more, and I'm engaged socially even, so when you have live sessions, being able to, and even though the thought of social engagement is hard to think about during a pandemic, but one day soon, hopefully, but the ability to engage with the other teams that are part of your cohort is an amazing experience. And the way I like to think about it is that I have now a whole group of national colleagues that I could call on to. So my neighborhood has grown. My neighborhood has grown not just with the members of my team. It has grown with the rest of the cohort, who I would have no difficulty reaching out to should I have a question or something that related to the work that they've done or are currently doing in a new role, as well as the faculty, the coaches, the staff at Healthcare Excellence Canada. It really is a growth of neighborhood where all of these individuals are really there for your success and are kind of like part of your forever neighborhood at the end of the program. So, I just want to, kind of wrap it up by saying, this is not just a 16-month experience. It is a lifetime experience doing this program. And for our project, for example, we still apply, it's still running smoothly. We've expanded it, and it still continues to grow as a result of some of the learnings we've had. So I'm a strong encouragement to take advantage of that.
Thank you so much, Courtney. I think we'll pause here to see if there's any questions while Courtney is here. Courtney, if you can stay till the end, it'd be great, because some people may come up with questions a bit later on in the presentation. But if anybody has questions for Courtney right away, don't be shy. Put up your hand or put them in the chat. It takes a little time sometimes if people are asking a question. So what I'll do, Courtney, is I'll start sharing my screen to finish off before the open question and answer, but I may come back to you if somebody types in a question.
Perfect.
Thank you again. Okay, so Patti.
Okay. Thanks very much, Courtney. You really provided very practical and helpful advice about the program. And I enjoyed hearing what were the high points and the gems from the experience for you and your team. And I also want to thank you for talking about the value of the network of fellows that you create by virtue of being a fellow in this program. It really is an important network that will build and build over time, because what happens is participants in the program often change positions at different times over the subsequent years. And if you stay in touch with them, which is really quite easy to do in Canada, even though it's a big country, it's a pretty small and circumscribed healthcare community. They can be extremely valuable to you as you exchange ideas and connect with them at different times. I think back to some of the my teammates in the extra program that I did in 2004 to 6. And one of those people is the president of the board of directors of HEC, Lynn Stevenson. Anyway, you know, it is a network that just keeps giving and giving over time. So let's take a look at how one goes about applying. First of all, the form can be accessed online on the HEC website and downloaded for review. You just have to enter a bit of basic information to access the form. And then your information, your application is submitted online via the portal where you got that application from. As Courtney said, preparing the application itself is really the first step in team building. So there are some things that you really need to, more specific things that you need to do to get ready, and I'm going to review those. The first is getting the support of your executive sponsor. Each participating organization will provide an executive sponsor. It's usually the CEO. This person will provide leadership and executive endorsement and support, both during and after the program as you work on spread. Talk with your CEO now to gauge his or her support for sending a team to the program. If she is not familiar with the program, there are great mini summaries of extra team profiles and the projects on the HEC website. So I really encourage you, you've probably already been there and seen that, but I suggest that that might be a helpful place to send your CEO if they're not familiar with the extra program. In just very brief encapsulated summaries, the CEOs will understand what's in it for them to be supporting an initiative like this. The core project team includes 3 to 5 fellows from different disciplines within the organization or from across organizations. And they may also be from different sectors, social services, education, not just healthcare. The team must include at least one person from the executive or senior management team. This is important. Sometimes the teams are fully composed of people from the senior level, but there needs to be at least one person from that senior management team who is a member of the core team. The team should designate a team lead who will be the primary point of contact between the team, HEC, and the executive sponsor, and who will provide guidance and oversight of the initiative, ensuring milestones are met along the way. In terms of the project summary and aim, it's essential to ensure that there will be some support from your CEO and executive team for the problem that you want to tackle. It's all about alignment with the organizational goals. So make sure that it is central, that it is on that executive and organizational level agenda. And it's the conversations that you will have with the CEO and the executive team that will help you ascertain whether you're on the right track with something that's fully aligned or how you may have to tweak things a little bit. So those early conversations are really important. Choose a problem that would be part of your ongoing work. Don't choose something that you've never really been involved in and that's completely new to you. It needs to be part of, this is a lot of work, as Courtney said. This is not something you can do just off the side of your desk. It really needs to be part of your day-to-day core work at the organization based on your role. Describe the problem that you're facing succinctly and state what your overall aim is. In other words, what would success look like? If possible, describe the impacts that you expect to see for patients, staff, and at the organizational or community level. In terms of the problem statement with supporting data, in describing your problem, you must provide both local evidence, such as the nature of the problem, the prevalence, the impacts on patients, staff, the community, risks associated with it, as well as national and international data about this problem. This is important. This is, again, it's a first step in using one of those levers, the evidence-informed decision-making. Local data is critical in the statement of the problem, but you have to do the additional work as well of looking at how this is viewed, either nationally or internationally. Why and how have others tried to tackle this problem? Next slide, please. You also need to plan how you're going to recruit others who are needed for your work to be successful. So let's start with patient partners. A basic requirement of the program is having 2 patient partners on your core team before you start the program. This is really important. You have to actually have the names and put them into the application form. Engaging patient partners in the design, delivery, and evaluation of major change initiatives is one of the 6 levers. With true patient engagement, solutions are designed and delivered with patients, not to or for them. Fellows frequently underestimate the time needed to recruit 2 patient partners. You may need to use a variety of methods to find patients who can commit to involvement over 16 months. It's best to choose patients who are familiar with the problem you're addressing. And if you haven't had experience previously with patient partners, you can reach out to HEC and we will assist you in some of the strategies that you might think to use to try to connect with patient partners. Many organizations, probably not all yet, but many organizations across Canada have patient and family-centered care as the core value and have listed patient engagement as a valued approach within organizations. That usually means, or should mean, that there is a particular group or set of persons who are designated to assist you with this in terms of the selecting, the recruiting, the orientation, not just of the patient partners, but the orientation that's needed by frontline staff who are 99% of the time are unfamiliar with having patient partners directly involved in changing how they work. So go to those people. It might be your quality department. It might be another department within your organization, but ask around to find out who are the people who have some oversight on that within your organization. A significant part of the curriculum is dedicated to building knowledge and skills to strengthen an engagement-capable environment in your organization. In terms of implementation team, as Courtney said, it's a lot of work. So you need to engage a number of different people to form a larger project team with whom you meet regularly. It should include experts from within or outside your organization for as-needed consultation and implementation support. That may include representation from frontline staff or managers. Physicians are important partners to keep in mind. Quality improvement advisors, project management support, persons with evaluation expertise from within your organization are helpful to have at the table, as particularly as you are developing your measurement plan. And possibly you may need to involve an information technology advisor. It depends on your project. In terms of the advisory committee, these are the people that you need to help navigate those potholes that Courtney talked about, the potholes that you will inevitably find along the road. Applications must demonstrate that the team will receive strategic advice and guidance from key stakeholders within each of the participating organizations. The advisory group minimally must include the executive sponsor, a minimum of 2 patient partners, and representation from the implementation team. It's important to consider other potential stakeholders in your region or province who may have strategic importance in supporting your work. So don't think necessarily about just the direct stakeholders. Have conversations around who some of those indirect people might be, who would be interested in hearing about your work and potentially engaging in some of your spread work. So reflect on that, have the conversations now early, and invite them early on. Don't wait until you're 6-8 months down the line. Back to you, Genevieve.
Thank you, Patti. Thank you for giving that that information and really good information as you're filling out the application form. Just want to talk a bit about other parts that the fees. So this year we've set the fee at $2,500 per fellow. And this covers the costs of travel, lodging, and 2 meals a day when we have the in-person workshop. It covers the licensing for a virtual platform. You don't pay anything extra than the $2,500 over the 16-month program. We do adjust according to how much virtual content there is in the program. So right now we're basing it on a few 2 or 3 in-person sessions. Should this not be possible, the cost would be adjusted. And just, I think we've Patti mentioned that, but we do have the core staff that's there to support you, and a desktop. So the other thing is to mention today is that we do offer pre-application coaching calls. They're 30-minute call with the lead coach and a member of Healthcare Excellence Canada staff. And this is a great way of going over what we just talked about, your application, but really talking about the project, and we will guide you to see if the scoping is right and help you assemble the teams. Patient partners, as Patti mentioned, we can help you there. But really strongly encourage to book a coaching call. In the call for application document, you'll find all our email, which is extra-force at hec-esc.ca. But we can put the email address in the chat, but it's all over the call for application document, and you will find it on our website. So strongly encourage the coaching call. The deadline to apply is set at June 18th right now. As Patti mentioned earlier, the application is an online platform. If you have any problems setting up your account or navigating it, we're here to help. I want to assure you that that platform, you can be more than one person, so everybody in the team can collaborate at filling out the application. And I believe you can download the application questions so that you can review them. The applications will be reviewed by what we call the merit review panel over the summer months. We put July. And they make a recommendation to Healthcare Excellence Canada CEO, who has the final decision on the teams chosen. We don't have a set number of teams that we don't say we'll take only 10 teams, but we vary from year to year, and we do take anywhere usually between, I think we need 8 or 9 teams to go. And we could go up to 12, maybe 13 teams, but we have those discussions together. We do the merit review this year over the summer months, but we put September there, but we're aiming for the end of August to be able to notify the teams, but maybe September 1st or just that first week in September to notify you. And we do go over the comments of the merit review panel with you during your acceptance, just so you know the comments they gave on your application. We will launch the program in October virtually, in the hope that we can gather for the first time early in 2022. So we will do you'll have an individual team orientation, group orientation, and we'll do some of the first sessions virtually, which we did with the current cohort. So we've learned from that, and it's very doable virtually, to prepare for a very engaging in-person session early in 2022. So thank you. And like we've been saying, there's some information on our website, the applications online, and always encourage you to subscribe to our newsletter to keep have the regular information. So I'm going to stop sharing and open it up for questions. I think there are questions. Yes, go. Okay.
So I see one from Tiffany. Tiffany Blair, thank you for your question. The question is, can you give some context around the scope of improvement projects to consider while developing the project? Size, impact, potential for spread. So there's a wide range, and Courtney can also speak to this, and Genevieve. We sometimes have projects that are contained just within one organization, or one department within an organization. I can think of several years ago, there was an initiative around that was involving labor and delivery. But most of the projects are fairly large in scope. So the intent from the outset is usually, so even if it's within the context of one sort of single building organization, the plan is usually for spread across that organization. And as was mentioned by Courtney's example, and we have had quite a few of the projects that are regional in scope and even provincial. So for example, in BC, one of the extra teams from a couple of years ago was trying to improve the triaging system by paramedics who arrive at the scene from a trauma. To have a standardized approach to for all paramedics anywhere in the province, and with a clear pathway for where the patient should be. And so that may mean bypassing the local general hospital and going a little bit further because you needed to get, because of the triage that is taught to the paramedics, to get them to an appropriate trauma center, a level 1 trauma center. So that was a very, very large scope initiative. There is another team right now from the Yukon that is developing a framework for evidence-informed decision-making that will inform all of the performance indicators, quality, safety, indicators that they choose as an organization on a go-forward basis. So they're completely revamping based on a major review that was done of Yukon Health and Social Services. Those are just a few examples.
Thank you. There's another question, and Patti, I think you may be able to answer this one better than I do because you've been with the program more years than I have. Have you had academic organization lead projects and enter the program, looking at the lens of our impact to health excellence further downstream as providers enter the healthcare? We have partnerships with regulatory and healthcare agencies. So yes, I don't know that there have been, but we would welcome that, obviously. But
yes, we have. And again, there was a BC example where we had the BC Nurses Association as one of the partners on one of the initiatives. When you mean academic organizations, I'm not sure if you mean academic health science centers or if you're talking more about university centers. So we have all of the above. There is a team right now, for example, from Quebec in the current cohort that includes one of the partners is McGill University School of Nursing, and a CIUS, which is the label for a regional grouping of healthcare delivery organizations in the Montreal region. It's just one of the regional groupings, but they are trying to increase the number of nurse practitioners that they have going into primary care. So it's a community-based initiative, but it has major hospital healthcare partners and the School of Nursing at McGill University. We have had a number of programs where university partners are part of the program. So yes, it's basically every size and shape partner is a go, is a green light.
I can't believe I forgot about McGill that was in this current cohort. Thank you, Patti. So just want to reiterate that it doesn't have to be a health authority or a hospital or health related. It's social services too. We held a French session prior to this one where the fellow who presented, their project was related to child welfare. It can, it can be broader.
Many of the initiatives are primary care based. That's a change that I've seen over time. Early on in the program, most of the applicants were coming from hospital centers or hospitals with community partners. And so we still have some of those, but increasingly we have seen many primary care based initiatives. We had a really great one that was with Kingston. At that time it was Kingston Hospital along with other community partners, and they were trying to introduce palliative care training amongst a broader network of home care nurses and primary care providers in the community, because there weren't enough palliative care specialists to meet the needs. So that was really about pushing that care out into the community and building organizational capacity at the community level.
There's a question that's probably good for Courtney too. It's the indication around the weekly time commitment for the program, Courtney.
Yeah, I guess a great question. And, and it really did vary for me. So, I'm going to be honest, when I started the program, I, was kind of finding time on, various days, and then made the decision that I really wanted to commit to some dedicated time, and actually went to walking 1 day a week where of the 5 days that was dedicated for the work. So I would say I put that 20% of my work week in, not that you didn't squeeze a meeting in if you had to. I think it was of value in terms of keeping things going, knowing you had the time, knowing, especially as a team made up from different organizations, that knowing that there was some dedicated time for us to meet if we needed to. But it also kind of changed the way I work post-program. So knowing that, you're doing other projects that you often don't commit time to, I've actually retained that day as a day that I keep in my schedule now, where I still put and apply some of the same principles to some of the new projects I'm involved in on that day. So it actually has changed the fact that I now commit time to projects that really need that commitment, so that it all gets that kind of a time that you need to put towards it for it to be successful.
And the other thing I'd say to that, because I would agree with about the equivalent of a day a week and the need to really protect and set boundaries around that, you should also talk to your CEO about that, because you're going to have people who want to book meetings into that space, and you're going to have to say, sorry. So it's helpful if somebody, particularly your project sponsor, can communicate some of those ideas at the outset with the rest of senior leaders and say, look, Courtney needs to have some protected time for this. So he's going to let us know what that is, and we're going to respect that. So those are pretty important messages to come from the executive level, because, we all know what happens with committee creep. It's unreal. So it may not be a full day that you can block out in one chunk, but maybe it's 2 half days. But protect it and defend it. And let your executive sponsor know when you're having difficulty with that. It's the only way to do it. I see Alex has asked a question about the
Yukon team and connecting, and it makes. I just want to say that I love doing this. So I will try to connect you. I love making connections, but I just want to give another example of what happened last year at the time of application. Is one team, their project was in the correction services, and they said, "Do you have anybody that's done that?" And we were able to connect them with a team also from the Yukon, who in the current cohort that was doing a project in corrections. And so I am happy if I can connect you with somebody. I will gladly facilitate that so that they were able to speak. And now we have this team in C16. So we have another team this year working on an improvement project in corrections facilities. So yes, I love to do that. I'm not sure if I'm seeing other questions, but I do about the time commitment. I just wanted it triggered that we do, once you're accepted in the program, we do send you a training agreement, and we have your CEO, your project sponsor sign off on it, but it does include that time commitment. So your CEO is signing a piece of paper saying, or your project sponsor saying that they will give you that time to work on the project. The other thing I thought I should mention, because I just mentioned in the French session, and it is a bilingual program, meaning that we are looking for subject matter experts across Canada, even internationally, to present on topics. And sometimes they speak English, sometimes French is a language to present. We ensure there's simultaneous interpretation. So you can be unilingual French, unilingual English, you can participate. There's no need for full bilingualism. Our interpreters have been with us for quite a few years, and we joke that they know the program, they know the terminology, and they're excellent. So. The next question is a timeline for scheduling the coaching call prior to submission. We are taking coaching calls as of now. And as I said, we are here to support you right until the deadline. But the coaching calls, I think it helps when you've thought about your project, obviously, and you have looked through the application and you're very familiar with the application and the different parts of the application. And we can focus to make sure that we can help you with that part. However, if you just need a call just to kick off, that's okay too. Like I hate to put a restriction on when you ask for a pre-application coaching call, but certainly being aware of the application and the questions we ask would be helpful. I don't know if Patti, you have an opinion on that or?
Yeah, I agree. The earlier you start, the better.
Yeah.
And if you want more than one coaching call, that's fine too. So you may have some certain questions you want help with figuring out right now, but then others are going to pop up. So you can ask for another call, you can send emails. Basically our job is to facilitate your process of reflection at this time and help answer any questions and give support that will help you determine whether this is the right time and fit for you.
Right. And once we receive your applications, before we send them to the merit review, we will give them I'll look at them, and if I see there's something missing, I will reach back to your team and maybe ask for some clarification if needed before it's submitted to so there is a bit of buffer built in before we submit them to the merit review panel, just to make sure the applications are complete and have all the information needed. I also want to remind you that we're asking for an abridged CV. So we're asking for your CV, but you just give us your work experience and a cover letter, but it's abridged. We're not asking you to do the whole CV. Okay, we just want to get a good idea for your current experience and past experience and your reasons for wanting to join Extra.
The other thing I'll add is that when you see the application itself, it's quite straightforward. It's broken down into sections. Read the instructions carefully and just give them what they're asking for there. It's not just an open-ended thing. It's quite a well-structured application form itself. There was something else I was going to mention about the form. I forget what it is, but it's pretty straightforward. And if you have questions, just send a text or an email off to Genevieve, and any of the HEC staff can guide you.
Okay, I don't see any other questions. No. Okay, well, thank you, Courtney. Thank you, Patti, and thank you, everyone, for joining us today. As I mentioned earlier, this has been recorded and will be available on our website until the application for time limited, until the application is due. So if some of your teammates want to listen to, it will be available shortly. And questions are always welcome. Our address is there everywhere on the website, and please do not hesitate to reach out to us for any question, whether it's mechanics of the application or anything else. So thank you, everyone, and have a great rest of your day.
Thanks. Bye-bye, everyone.
Thank you. Good luck, everyone.